Joining me now is Dr. Paul Offit. He is the director of the Vaccine Education Center at Children's Hospital of Philadelphia. Welcome, Dr. Offit.
Thank you.
If we remember the timeline of the development of the COVID vaccine, we went into lockdown in March of 2020. I believe the first shot in arms of healthcare workers was December of that year, if I wasn't mistaken. That's less than a year. A traditional vaccine takes 4 to 5 years of development. Why is it so much faster?
The typical production cycle for mRNA, once you have the genome sequence of the virus, it takes about 3 months to produce. The reason that this was so fast is one thing, Operation Warp Speed. Operation Warp Speed basically took the risk out of it for pharmaceutical companies. So now they could go right from phase 1 to phase 2 to phase 3 trials. They could mass produce the vaccine at no risk to them. When they were mass producing millions of doses of that vaccine, if they then found out that the vaccine didn't work in those trials, they could throw away the vaccine at no cost to them. That's why it was so fast. It was Operation Warp Speed.
RFK Jr., in making this decision to cut $500 million in funding to development of mRNA vaccines, as part of his justification of this decision, says essentially that when we've seen mutations of, for instance, the COVID virus, that the mRNA vaccine has not been able to protect against these subsequent mutations. Is that accurate?
No. If you look at studies by people like Ruth Link-Gellis at the CDC, she does retrospective studies looking at people who did or didn't get the mRNA vaccines in 2021, 2022, 2023, 2024, to see whether or not they were more likely to be protected against serious illness than those who didn't get the vaccine. So the vaccine continues to work. So RFK Jr. is wrong about the fact that the virus mutates away from recognition by antibodies induced by the vaccine.
What about some of the side effects here? And I know, for instance, that myocarditis was a significant side effect, especially for young men that were getting the COVID vaccine at the time. Myocarditis, of course, is the inflammation of the heart muscle. Do the benefits outweigh the risks here when we talk about the mRNA vaccine? And do we know if the side effects are connected to the mRNA technology?
So first of all, when you get a vaccine, like the mRNA vaccine, you induce an immune response. When you induce an immune response, there are certain proteins that are made as part of that immune response. Those proteins cause symptoms: fever, headache, joint pain, muscle pain, back pain. So that's just you developing an immune response. In fact, I'll give you a perfect example. A friend of mine volunteered for that early Pfizer trial because he wanted to be in the vaccine group. So he gets either vaccine or placebo. He doesn't know which. And then a day or two later, he starts to have sort of low-grade fever and sort of headache. And he looked to his wife and said, "Yes, I got the vaccine."
So what about myocarditis, though, as a potential side effect that we saw significant numbers of those?
Right, especially for boys and men between 16 and 29 years of age, myocarditis certainly could occur. So myocarditis is inflammation of the heart muscle. But unlike the virus-induced myocarditis, the myocarditis induced by the vaccine was invariably short-lived, self-resolving, and really of little consequence. On the other hand, for the first couple of years of COVID, when our hospital was overwhelmed by that virus, we saw a lot of myocarditis in children that would cause them to go to the ICU and occasionally die. Both the vaccine and the virus can do it, but the vaccine to much less commonly and much less severely.
When we think about where we are now with a cut of $500 million in funding for mRNA research, that has been ongoing for decades, by the way. This is not necessarily a new technology. What does that do for our preparedness when it comes to the next pandemic we may face?
Right. So I'll give you a specific example. I think the real hero in many ways of this pandemic, the COVID pandemic, was NIH, National Institutes of Health. Because what happened was in 2002, 2003, when SARS-1 raised its head in China, they started to make an mRNA vaccine against SARS-1. And although SARS-1 never came into this country, although it circulated in the world, we learned a lot. We learned about how to make an mRNA vaccine against that particular coronavirus. So when SARS-CoV-2 raised its head in 2019, we were much better prepared. By eliminating that money, especially regarding, say, the H5N1 vaccine, you're putting yourself in a more precarious position should H5N1 or bird flu actually become a pandemic strain.
RFK Jr. saying HHS determined that the mRNA technology poses more risks than benefits for these viruses. What is your reaction to that?
I don't know what he's talking about. I mean, the mRNA technology was one where that could be scaled up very quickly. You were 12 times more likely to be hospitalized and die of COVID if you didn't get a vaccine than if you got one. In 2022, you were 6 times more likely to be hospitalized and die if you didn't get a vaccine than if you got one. So the vaccine was highly effective, and it was remarkably safe. I think we paid a very small price, actually, for the efficacy from that vaccine, because every medical product that has a positive effect can have a negative effect, sometimes a severe, sometimes a fatal negative effect. This was a highly effective technology. For this virus, I think it could be a highly effective technology for other germs, pathogens, and also can have a platform in cancer, a platform in gene therapy. So to withdraw all that money is just enormously short-sighted, and I think was a very bad day for science.
When you hear the HHS secretary saying the COVID vaccine was the deadliest vaccine, quote, ever made, what does that mean for both science and for the messaging around vaccines in general in this country for the future health of Americans?
You would have hoped that when he became Secretary of Health and Human Services, instead of serving Children's Health Defense, which is the anti-vaccine group that paid him, that he would now actually serve the American public by giving us the kind of information that improves our health. But he doesn't. He's still an anti-vaccine activist, putting bad information out there that puts people in harm's way. First of all, in terms of the most dangerous vaccine ever made, I'm going to go with the Qatar incident, which was a polio vaccine made in 1955. The way that vaccine was supposed to be made is you take poliovirus, grow it up, purify it, kill it with a chemical. The company that made it, one of the companies that made it, Qatar Laboratories, failed to inactivate that virus. So a couple 100,000 people, mostly children in the West and Southwest, were inoculated with live, fully virulent polio virus. I mean, there were 40,000 cases of abortive or short-lived polio. There were about 164 people who were permanently paralyzed, and 10 were killed. It was probably the worst biological disaster in this country's history. I would make that the most dangerous vaccine ever made.
Dr. Paul Offit, you are a wealth of knowledge, as we would have expected on this, and we appreciate your time, sir. Thank you.
Thank you.
And we should note, Secretary Kennedy did say the money would be shifted to, quote, safer, broader vaccine platforms that remain effective even as viruses mutate.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.